All right, Mac. So today we
Yeah.
are going to talk about headaches. And if people who are listening and watching, if they wake up with headaches, your body is probably struggling all night because headaches in the morning are not normal. Sleep should restore your brain. If you wake up in pain, something is wrong. So let's talk about one of the most common symptoms people ignore, waking up with a headache. A lot of times people just assume it's stress, being hungover, or just sleep went wrong. But if you're listening to this and you're waking up with headaches regularly, it's your body way of telling you like you're struggling all night while you're supposed to be resting. So why is waking up with headaches something people should take seriously, Mac?
Because it's not right. I mean, when you're sleeping, you're supposed to be shutting everything off to let the brain rest. And if you're not doing that and you wake up feeling worse than when you went to bed, something is wrong. And if you have a headache, both Pam and I know that it can be a couple of things, and usually they work together. And one is seeking airway to get air during the night because you have apnea or some type of obstruction of breathing, and or the teeth are grinding and they don't fit, and it just like gears in a car, if they don't fit, bad things are going to happen. And it's the muscles that respond. It might be the joint that responds, but a morning headache, and not only waking up with a headache, but being woken up by a headache is another symptom to look for with both sleep and TMJ. Now, Pam, I'm going to give you all the credit for knowing a heck of a lot more about sleep than me because you have really done a deep, deep dive into sleep. So tell us what happens when a person is searching for air.
So when a person is searching for air, what happens is usually there's some kind of obstruction when they're sleeping. And what I mean by an obstruction is that there's a physical blockage, usually being the tongue, being in the throat, in the nose. You can have swollen turbinates, which are what filters the air, and adenoids, they block the nose. But let's focusing on the tongue specifically. Let's say somebody has some kind of sleep disorder, whether it's apnea or upper airway respiratory syndrome, which is the lesser version of it. What our body is, when we're sleeping, what our body is constantly regulating in the brain and just above the heart, there are little receptors, and it's measuring the amount of CO2, carbon dioxide, in the blood, and not even oxygen. We always think it's oxygen, but it's actually CO2. And of course, the CO2 is supposed to be blown off, oxygen is supposed to be blown in, but the brain and the heart chemoreceptors are measuring CO2. So let's say somebody's tongue falls in their throat, their jaw set back, they have an obstruction. Well, there's no air coming in. And so the CO2 is not being blown out and oxygen's not coming in. And we start to get a buildup of carbon dioxide in our bloodstream. And so the brain starts to pick that up and it signals to the heart via the vagus nerve specifically. And it tells the heart, hey, why aren't you doing your job? Speed it up so that the oxygen and carbon dioxide exchange can occur at the right ratio. So the heart starts pumping faster and faster, get tachycardic, right? Or arrhythmic. But the problem is not the heart doing its job, is the fact there's no intake coming in. So this ends up causing a reaction in the diaphragm where it starts to spasm because your body is under sympathetic stress and it's trying to say, hey, fight or flight, something's wrong, something's wrong. The heart's not making anything right, nothing's working. So the diaphragm starts to spasm. The Another nerve starts to trigger your jaw to actually move forward, which is why people grind their teeth at night, because when the jaw comes forward, it gets the tongue out of the throat. But if your teeth are in the way, well, you're going to grind your teeth away. But all of these things are to trigger your body to wake up. And so it gets your tongue out of the throat. You take that big inhale of air, oxygen comes in, and your body starts to relax for a little bit, depending on the severity of your condition. until the tongue falls back in the throat, and this whole cycle repeats over and over and over again. So when this is happening, we're not getting good oxygen perfusion through our body, which can cause muscle pain and just poor circulation through the body, brain function, cognitive development. The muscles in the jaw and in the forehead are also working all night long to get your tongue out of the throat. They're spasming, they're fatigued. That also contributes to the morning headaches. So this airway issue causes the two fundamental, most common reasons why people get a headache, just not good oxygen perfusion, and then muscle fatigue from constantly working all night long. You could be sick, but constant morning headaches, that's not normal. Grinding your teeth, that's not normal. It's usually an airway issue. So headaches, especially in adults and children, it's an airway issue.
That is just fascinating and so complicated. And it makes me think that, the heart and all the organs of the body kind of have their own brain. That if they're not getting what they want, then they cause other things to happen.
Right.
And, so how could the tongue falling in the throat create all those problems? And to make it very, very graphic, if one were to open their mouth and open their throat and somebody took a chunk of meat and threw it in the back of the throat, all kinds of things would immediately happen.
Hmm.
And so when the tongue goes back in the throat, the same thing happens. And I know that from my limited knowledge of it, there's cortisol is secreted, hormones are secreted, insulin's secreted, and all of these things are secreted in the body. It just goes into, it's just attacking itself or whatever the definition is. But it's a pure stress on the body for that tongue to fall in the back of the throat.
Right. And so many systems happen. The body is incredible. How, like, just at the end of the day, we can go without food for days, we can go without water for less days, but we can't go without air for just a couple of minutes, even the best athletes. So our bodies will do everything to compensate. And that compensation is what causes all that wear, tear, and dysfunction in your body. And headaches is one of the many ones that present when you have an airway issue. A lot of times people just discount morning headaches and then they bounce between doctors. And then doctors always say, well, maybe it's stress or maybe it's your diet. A lot of times my patients that come in, Mac, I'm sure you had this in your office, people that have daily headaches and frequent migraines, there's no explanation. I mean, they've been to the eye doctor, the ear doctor, and the neurologist, and ultimately they're just given medications to manage symptoms or suppress and, anesthetize the situation, really. But the cause is never discussed. And that's such a big point of frustration for me, Mac. And I love the fact we do this because it's for you listeners to be aware and ask questions like, if you have headaches and migraines, get a sleep study done. Get a sleep study done. Just get screened. It's not a big deal and they're not that expensive anymore. Just get a sleep study done to see how you are sleeping. The Aura rings, the Whoop bands, these smartwatches are wonderful for tracking trends, and I love them. And anybody who seeks me for sleep, I say I would love for you to buy one of these things to track your trend. They are not diagnostic. It's not a true measurement, but it is relevant for trends. So when I make a sleep appliance for patients, for example, Mac, um, they've been tested. I know their numbers. I usually have them do a 2 to 5 night sleep study with very simple things at home because, a lot of doctors will say, come have a 1 night sleep study, whether it's in home or at a clinic now, and you have to be sober. Well, let's face it, most Americans are not sober. So can we be real? Let's
Yeah.
open up, Mac, right? Like we're always real. So I always say
This,
have one dry night, and then the other nights we do, have it be a weekend night, whatever is your normal night, because that's going to be your real life, and then
that's
you
right.
also get to see, wow, how much does alcohol or other things impact my sleep? And you can decide if you want to drink that night, and how you want to sleep. So, the we need those sleep studies. That's part of the diagnostic process. And then for us, we also take a CBCT to see where is the airway obstruction. Is it really the tongue that's falling in the throat because the jaw is too far set back to begin with? Which 9.5 out of 10 times, actually 9.999 out of 10 times it is. Or do they have issues in the nose? Is the patient obese? I mean, is it all of these things? Are the jaws constricted? But before we make oral appliances, I need to know the anatomy and we need to know your numbers. Do you have a true medical condition, or is it just snoring, or is it your hormones, or is it other thing? But then using these sophisticated tracking devices, it's wonderful because like I tell a patient, they're like, how often do I have to come back to see if the appliance is still working? Is it just subjective? Is it how I feel? Well, that's very important, but we also want to know numbers. I'm like, use your Aura Ring or your Whoop Band. And if you see a month where all of a sudden you went from having excellent sleep to like now it's like fair and poor, and it's just tracking that same way. Well, time to do a check-in and let's have a conversation. Did you change your medication? That's when they need to come back and we'll do another sleep study and maybe titrate their appliance. But anyway, I think I got off track with that.
Well, I mean, you sound like more than a dentist.
I am fabulous, Mac. I try.
No,
Dentistry was the fundamental, right? But
you
all
know,
things
in
come
in
together.
dental school, we learn about gum disease and decay and how to do fillings and how to do crowns and how to do this. No TMJ, no sleep. And now TMJ has come along and is still barely in the dental schools. And then now we're talking about sleep, which involves the entire body. I mean, the mouth is the gateway to your health.
Yeah.
And we're just little bitty dentists that don't know anything, and that has to change. And you are a perfect example of that change.
Thanks, Mac. I mean, we cannot separate the mouth from the rest of the body.
No,
Like doctors shouldn't be fragmented. We cannot address just one thing. Um, people always say, like, why do you call yourself a dentist? Because that is what I am. I don't know what to call it, but to me, it's all about functional. What way we treat our patients is in true concept of functional. It looks at the airway from infancy to children to adolescent to adult. This is how we function as humans. And as soon as one part of us starts to dysfunction, another system, as we get older, as time goes on, another system dysfunctions, system dysfunctions because everything connects and everything is trying to compensate for whatever that dysfunction is. So, as a functional dentist, for me, it's so important to understand the root cause of all this. And you have to have the time to talk to your patients like you did. You have to have the equipment and the training to understand it. I don't do a lot of teeth and gums anymore. I have a wonderful associate that does, so that I had this time to focus on it. Because as you know, Mac, you became so much more than a tooth and gum dentist, and there's nothing wrong with that. It's just that's where we all start, and then something shifts us to want to know and understand more. And for me, I don't want to write a script. I don't want to just drill a tooth. I don't want to put a crown. I want to help people look good and feel good as long as they're on this life, on this earth, and have it be a very long, good looking and healthy life. That's what I want from them.
I would consider you an airway dentist. I would consider you a TMJ dentist. Would you agree?
I would, thank you. But I feel like right now, Mac, I don't know if you know this anymore. Like airway dentistry is not the hot cake term. Like everyone's an airway dentist. So I'm like, that's frustrating. I mean, what makes you an airway dentist? Because
That's what I want to clear up. So, with an airway issue, that when it occurs, it chemically alters the body. It does all kinds of things to the body, but it also does something to the teeth because the teeth are hitting and you're grinding and you're searching for the right optimum jaw position to get airway. And a lot of times it's clenching to be able to try to get airway to, brace the throat and a lot of complicated things. But a sleeping oral device, a MAD, a mandibular advancement device, is going to pull the lower jaw forward, which pulls the tongue forward, which opens the airway, correct?
Correct.
The second thing is it's an upper and a lower appliance that has flat surfaces. So teeth have humps and they have cusps and they have all this. And if they go side to side, these cusps interfere with one another like gears in a car. But these flat appliances that you can slide from side to side, which the appliance allows you to do, and that takes away the pressure from the teeth, which takes away the pressure from the muscles. And the muscles are also what's causing your headaches.
Hmm.
So it only makes sense if you wake up with headaches that you probably have airway issues and you have TMJ issues, and then the solution is an oral appliance at nighttime and maybe during the daytime to relax the muscles and allow for a patent or opened airway so you get the needed oxygen. Would I be correct?
Very much so, and oversimplified because, right now you can get these oral appliances on Amazon or at CVS or Target. And in fact, medical doctors are making oral appliances. So, just my biggest take home from this is that if you're getting morning headaches, it's not normal. You need to have a sleep study done. And if you do have sleep apnea or an airway issue that's causing your morning headaches, an appliance can be very helpful, but you have to be very judicious on the right kind of appliance to pick. And you can try to get one on Amazon and maybe by luck, because a blind squirrel will even find a nut sometimes, right? And it may work, but I'm very apprehensive about over-the-counter products or the medical doctors making these appliances because if you have a sleep issue, you probably have an underlying TMJ issue that can get exacerbated or it can get triggered if it's not already triggered. So you have to be cautious about that. That I
Well, and the thing is, it's not monitored. The OTC products are not monitored, and you are very strict, and it's very obvious that you monitor using home sleep devices, sleep studies,
correct.
to be able to monitor if they're getting the proper oxygen or not.
Right. I want to make sure
That's
the
what it's all
appliance is
about.
working. We need to do that follow-up. And aside from that, like the way we position the jaw is that's the magic in it. It's not arbitrary. There's no guesswork. It is based off of science, understanding the anatomy from the imaging, understanding where the muscles are comfortable through TENS, which is that transcutaneous electrical neurostimulation that Mac and I have talked about in other podcasts. There's nothing arbitrary about the bite position that we make for our patients. And that's why it's so effective with their sleep and their TMJ issues, whether they know or feel they have one or not. So that's the difference there.
That bite position is measured in tenths of millimeters. So it's very critical, and you really got to know exactly what you're doing when you're using an oral appliance to be able to take care of your apnea. It's dangerous if you don't know what you're doing.
Yep. So we're not saying that to, freak anybody out, but you really do need to know what you're putting in your mouth because, there was that company Smile Direct for a while that you could do your own straightening. Well, that's not around for a reason anymore because that was causing all kinds of problems. So, I want you to know that there are solutions if you have morning headaches. It's very fixable. You just have to have the right appliance made for you. And before that's done, you have to be diagnosed correctly. Make sure the issue is a mouth issue, not a nose issue, and or anything else. So
A
if you
hundred
wake up,
percent.
thank you. If you wake
Uh,
up with headaches, just to nail the thing home, Matt, because you know me, I'm so um, if you're waking up with headaches, your body is telling you that there's something functioning wrong when you're sleeping. And the question I want our listeners and watchers to think about is not so much what medicine can I take to fix my headache, but it should be what happened overnight that created it.
Very good, Dr. Pam. Very good.
Thanks, Matt.
Impressed as always.
All right. Hopefully, this was helpful to our viewers. Please, if you have questions, leave comments. And remember, so much of what Mac and I talk about is also in his kind of do-it-yourself book, the TMJ Trifecta, Solving Your Pain Puzzle. There are chapters on that breaks things down on like things that you can observe with yourself and how to ask the right questions to find the right doctor and treatment.
But if you want to prevent it, then you read your book that's also on Amazon, right?
That's right, Mac. We've got to
All
plug because people need to know. All right, friend. Good to see you. Thank you.
right. Bye.